Hello, and thanks for joining us. The Delaware-Morrow Mental Health and Recovery Services Board was created to provide a unified system of mental health treatment and supports for individuals residing in Delaware and Morrow counties with mental illness and addiction. In other words, we make sure those who need mental health or addiction services can get the quality care they need. In this video, we'll show you some tips, tricks, and expert advice to help keep you more mentally healthy and in control during these challenging times. The COVID-19 crisis has been one of the most challenging times any of us has lived through. And while the disease itself has taken a massive toll on the population, the side effects of living through the pandemic have been difficult all on their own. Here's the most important thing to remember. These are not normal times, so it's perfectly okay to not feel like your normal self. Feelings of stress, anxiety, fear, anger, and frustration are normal. Remind yourself, though, that these are normal reactions to abnormal events. If you have a pre-diagnosed mental health or addiction issue, it's crucial that you stay in touch with your doctor and follow your treatment plan, whether it means staying on your medication, attending counseling sessions, or participating in other forms of therapy. You also need to be on the lookout for new symptoms and relay these to your doctor. Something else you can do is to stay active. It's so easy to feel like you're stuck inside and alone during this time, and that can make any negative feelings worse. You have a lot of options for getting out of the house, and with basic precautions, these options can be very low risk for catching the coronavirus. Delaware County has several parks with accessible hiking trails, opportunities for shopping and dining, even just walking around downtown. As long as you remember these guidelines, you can get through with minimal risk for contracting COVID-19. Remember to keep your social distance, at least 6 feet. Wear a mask, sanitize or wash your hands frequently, avoid crowded areas, and keep in mind that outdoor activities are generally much safer than indoor. With Ohio weather, it's not always easy to get outside and stay active, though. So keeping in touch with friends and family can offer you a break from the everyday monotony. Make an effort to call or FaceTime, Zoom, text, write letters, or even connect on social media. Just a 5-minute conversation with a loved one can make you feel so much better than you did before. We mentioned earlier in the video about negative feelings that should fade after a short while. But what if those feelings stick around? It's important to keep track of how you're feeling and look for the signs of mental distress. If you start feeling hopeless or helpless, having intense or prolonged feelings of numbness, disbelief, anxiety, or fear, experience changes in appetite, energy, or activity levels, have difficulty concentrating or sleeping, or even physical symptoms like recurring headaches, body pains, stomach problems, or skin reactions. Or if you notice an increased use or desire to use alcohol, tobacco, or drugs, then you may be in distress and should try to get some help. The easiest way to do this would be to call Helpline at 1-800-684-2324, where trained professionals will guide you to the help you need, whatever it may be. The COVID-19 pandemic has shown just how important technology is in our daily lives. We rely on our computers, phones, and televisions to connect with the outside world when the best health advice is to stay inside and stay distant. Right now, we're using technology for work, socialization, and staying up with current events. But you can also put it to work for your mental health. Virtual meetings have become more and more commonplace. Instead of meeting people face-to-face, you can connect screen-to-screen. The ability to connect to people through these platforms can give you a chance to see friends and coworkers. Also, it gives your doctors a way to meet with you without being potentially exposed to the coronavirus. It can be great to actually see the faces you're talking to and have the ability to have multiple people in the meeting at once. That means that social group that you usually hang out with can go from meeting in public to meeting online. Another way to stay connected is through social media. Whether you're on old standards like Facebook, Twitter, or Reddit, or if you're trying a new community like TikTok, social media gives you a chance to link up with friends and family or meet people from around the world. Social media and even virtual meeting programs can have a negative effect if you're not careful. Helpguide.org outlined this negative cycle that comes from using social media in unhealthy ways. When you're feeling down, you can turn to social media for a quick boost. Using social media more often, though, can increase feelings of inadequacy, dissatisfaction, isolation, or even a new phenomenon known as fear of missing out, or FOMO. Not surprisingly, these feelings make you feel worse than you did before. These worsening symptoms cause you to use social media even more, and so the downward spiral continues. Simply put, limit your time on social media and online meeting apps, and make sure you're getting your news and information from reliable, healthy sources. This way you can put technology to use for you in maintaining your mental health. With the invention and mass production of smartphones, we now have access to literally millions of apps that serve an endless array of functions, and keeping up with your mental health can be as easy as clicking to download. The app stores for both Android and Apple devices carry tons of apps designed to help you keep your mental health in a good place. If you're looking for help with mindfulness, find an app with guided meditations, mindfulness exercises, yoga, or breathing exercises. A lot of people get help keeping their schedules straight with reminder apps. These can help you keep track of doctor appointments, important events, times to take medications, or even simple reminders like drink a glass of water or stop, slow down, and take a few breaths. Just like social media, it's easy to get sucked into spending your entire day staring at your cell phone or tablet, so be careful. We mentioned earlier that being in the middle of an extended stressful period, like this pandemic, can lead people to increase alcohol, tobacco, or drug use. Being stuck at home, missing the access to your usual activities, increased depression and anxiety, even just boredom. All of these are factors that can lead someone to start self-medicating. If you find yourself using more often, it would be a good idea to reach out for some help. Aside from the expected negative effects that come from drinking, smoking, or using drugs, the National Institute of Health has also found that abusing these substances can make you more susceptible to the coronavirus. This behavior can be especially dangerous if you're already taking prescribed medicine for a different medical condition like diabetes or high blood pressure. If you are taking medication, it's very important that you stay on your normal schedule and also keep in touch with your medical providers. Misusing prescription drugs, even by accident, can have deadly results. Thank you so much for tuning into our video. We hope you were able to learn something helpful. For more information on mental health or addiction services, or to learn about our network of behavioral health providers, please visit our website at DMMHRSB.org or find us on Facebook. Thanks and have a wonderful rest of your day.